Welcome to Health Focus, where we focus on your health. Today, we're focusing on a lifetime in obstetrics. I'm your host, Dr. Scott Anderson, and I'd like to introduce you to a member of the community who has done a lot to serve the medical needs of our citizens, Dr. Gary Matsumura.
Thank you for having me.
Dr. Matsumura, it's really a pleasure. And as you can see, I read your book and marked it up with little sheets of paper so that everybody could see what it is. And it's a tremendous read. This is unusual because it's really a book written for anyone who's interested in what it's like to be a practicing doctor over decades, particularly in obstetrics. Tell us, how did you come to write this book, Adventures in Obstetrics, Helping Women Deliver Their Babies with Other Humorous and Heartfelt Stories? Gary Matsumura, MD. What led you to write the book?
Well, it's supposed to be a humorous book, although I think Barnes & Noble has put it in their obstetrical section, but I wanted to model my book after the books of David Sedaris, who writes humor. And I came up with the title, Adventures in Obstetrics, because I liked a movie called Adventures in Babysitting. And I wanted people to know that this is not a textbook on obstetrics, it's stories for the general public.
And I think it reflects a particularly long career. Tell us how you got into medicine and how you got into OBGYN and how you wound up in Fairfield briefly, just so we kind of know how it all started.
Well, I went to medical school in Loma Linda, California, went and did my residency in East Los Angeles. My wife and I talked about what specialty should I go into, and I chose obstetrics. We chose it because it has the only patients in the hospital that are well, that are healthy, and you don't see so much morbidity and mortality. It's also a field that allows you to do surgery, and I wanted to do a surgical specialty. I ended up in Fairfield because Northern California is my home, and we've really enjoyed Solano County. I'm actually from Mountain View, but we've been here since 1982. It
says on the back of the book that, in fact, this is a picture of you when you're just a little bit younger, I think. And although you still look very fit and healthy, it says you've delivered over, is it 9,000 babies?
Yes, approximately.
So when you're walking around the community, you must be recognized when you pass families. They must say, oh, there's Dr. Matsumura.
It happens a lot, yes. I wish I could say I recognize them. I often do not. And they'll say, oh, you recognize me. I'm the one whose bag of water broke before I went into labor. And I go, oh, that was you? That's like half the patients. Sometimes I'll be at the mall and someone way down there will say, there's my doctor, he shops at the mall. They'll come running up, and I'm thinking, if all of us Asians look alike, how did she know it was me? But they do recognize me, and it's a nice feeling to be recognized.
And you mentioned in your book that one of the things in your training that really struck you as a formative experience was when a woman died shortly after delivery due to an amniotic fluid embolism, and it was not preventable, but it still really had an effect on you. So OBGYN, OB in particularly, almost always has a happy ending in the US, but when things turn south, it could really be tragic.
Yes, one thing that people are not aware of is that women do die in childbirth, in pregnancy, and it's pretty unexpected. I got through that event as a resident okay, but I had a younger friend, an intern, who was thinking about OB, and he eventually became an obstetrician, but he was having second thoughts that day. He was pretty traumatized by the maternal death from amniotic fluid embolism. And you would think as time is going on, there'd be fewer maternal deaths. But actually, surprisingly, some years the numbers are actually going up. And we're not always certain why that is. Is it because women are choosing to have children later in life? Is it due to obesity? But when I first came to Fairfield, I don't recall any maternal deaths in the first 20 years, and then it's become more common.
And I was going to ask you actually about medicine and how it's changed, so this is a good time. You were in practice for 30 years or more, right?
Right.
How has OBGYN changed just in a fundamental manner since then? Obviously, I mean, there are more women in the field, that's an obvious change, but how about the technology?
Well, I could not even imagine doing obstetrics today without ultrasound. When I was a resident, ultrasound started to become popularized, but we used to diagnose tubal pregnancies in the emergency room without ultrasound, and it was tough. And it was rare to diagnose a patient before her tube ruptured, but now it's quite common to be able to do that. And that's in gynecology. In obstetrics, of course, I can't imagine not having an ultrasound for instance, dating the pregnancy. An older professor once told me that in the 50s, if someone went 3 weeks overdue, they'd thought, oh, we're just off on our dates. And then the baby would die and they'd say, oh, she really was quite overdue. But nowadays we have ultrasounds that can date fairly accurately. The patient, of course, looks forward to that first ultrasound, seeing the baby's heart beating for the first time. It's not always a good result. Sometimes the heart isn't beating and you discover they're having a miscarriage. But for instance, a woman will come in, we'll be doing the ultrasound, and I'll find twins. And I'll say, well, here's a heartbeat. And what do you think this is? This is another heartbeat. And she'll go, oh, right. Wow, this is really something. I've learned that if you carry that discussion any further, she hears nothing. If you want to tell her about how many ultrasounds she's going to need in pregnancy, the risk of C-section, a risk of abnormal lie of the babies, she hears nothing. Once she hears the word twins, you just wait till the next visit to discuss those things with her, because she's thinking, oh my God, maybe the pregnancy was unexpected. What is she going to tell her spouse? And so on. But ultrasound's been a big change for us in OB. In gynecology, we're now able to do what's called minimally invasive surgery, where we can take out uteri the size of melons that say have fibroids through very tiny incisions. You don't even need a Band-Aid. You can sometimes just put a drop of glue on the incision.
You know, I find myself falling into shop talk with you as a fellow physician, and I feel like asking about differences in care in different countries and technological advances, but what I really want to focus on is you really became, Dr. Matsumura, a storyteller. And this is a tremendously entertaining book, and it's largely about individual people that you've interacted with, whom we've interacted with in the OR or other locations. And one, for example, was a Jehovah's Witness who did not want to receive blood transfusions. There have been cases of explaining cesarean sections to patients and dealing with death and other tragedies, but also happy events, and also the interactions with your own family, the issue of culture and ethnicity, and interacting with people who may prefer not to have a male doctor, for example, gender. How did you become such a great storyteller? Because I feel like you are a storyteller and an entertainer as well as an educator. Is that something that you've done over the years, this kind of writing?
Well, when you have patients in labor, you know, on television, they're in labor for about 20 minutes and then the baby comes out. But in real life, people can be in labor for 3 days. So there's a lot of downtime. And I often would tell the nurses stories or jokes, and they were very entertained. And I thought, I wonder if this would translate into writing. Can you take a little story or a joke and turn it into a chapter? Because you can't just tell a joke and a punchline and consider that a chapter for a book. So I had to see if I could develop it into a whole story. And I think I've been successful with that.
So, do you have a favorite story among all of the stories in this book? I mentioned a few of them. You also mentioned that you had a colleague in the OR, I think her name was Suzanne, and because you were a fan of James Taylor, you called her Suzanne, the plans we made put an end to you, from a James Taylor song. So you have great stories. Do you have a favorite?
Are you familiar with that song?
Oh, sure. That was describing a friend who committed suicide, I believe.
Yes,
And it's,
yes.
yes, and it came out around 1970.
Yes, exactly.
Yeah.
So Suzanne was a surgical first assistant, not a doctor, but she would help me with C-sections. And I would call her in the middle of the night, and she'd answer, and she'd say, "This is Suzanne." And I couldn't help myself. I would just go into the song. I'd say, "Suzanne, the plans they made put an end to you." And she, she's younger than me, so she didn't know what that meant.
Right.
But one day, we're finishing a C-section, and she says, "I was talking to my mother yesterday," and she says, and I told my mother, "This doctor I work with, every time he hears the name Suzanne, he starts singing that song." And her mother said, "I named you for that song." Wow, that's pretty cool. During that same C-section, I thought, well, Suzanne, I know you're in your late 30s, but I wonder if you can name all 4 Beatles. And she thinks, and she says, "Is one of them James Taylor?" And the whole operating room becomes silent. And of course, in C-sections, the patient's awake. The patient says, "Are you, expletive, kidding me?"
But that's a lighthearted story. In the case of the Jehovah's Witness, you reached out and you managed to share your own experience culturally and from a religious perspective, and eventually persuaded this young woman to allow a transfusion. Is that more or less what happened?
That is what happened.
And her mother was in tears. She was so happy that her daughter would live. So that's a serious story, but tell us about it.
Well, I had a colleague, and we were in the doctor's lounge, and she said, "I have a patient, and I'm concerned that she may die. She's a teenager whose periods have been so abnormal for so long, she's at a point where she cannot even stand up without getting faint. And she's a Jehovah's Witness, and her mother is encouraging her not to accept blood." So I said, "Do you mind if I talk to her?" So I went in and talked to her, and I told her my own religious experience, being a Seventh-day Adventist, which I no longer am, but I gave her my background, and I told her we would honor her wishes. But I'd like to discuss it with her, and it came out that it was her mother's religion, I told her, more than hers, because she drank alcohol, she was having premarital sex, and not really living the Jehovah's Witness life. I said, you have plenty of time in your life to choose a religion if you desire to, but I think this is your mother's religion at this time, and you could choose to accept the blood. And she said, "I do want the blood." And the mother burst out in tears. Now, I thought she was upset with me, and she truly did not want her daughter to accept the blood, and would have preferred that she died and then followed their beliefs. On the other hand, her belief was that she wouldn't see her daughter again until the second coming of Christ, and that would be very difficult to accept also. So in a sense, she was very relieved. It could have gone the other way. Things could have had a negative outcome, but fortunately, things worked out.
You also described your method, as it were, of dealing with individuals when you were on call if the patient had a strong preference for a woman doctor. And I think on the one hand, you tried to be respectful of that, but also tried to offer them a way to accept you as a doctor by having a little conversation, coming in, talking to them. And often they would accept you as their treating physician. Could you share with us how you handle that?
So when I became an obstetrician, when I was in training, most doctors and most obstetricians were men. Today, women make up the majority of those in medical school and certainly in OBGYN residencies. Fortunately for us male physicians, maybe as much as 70% of women will accept a male or female. They don't care. They're okay with either one, delivering them or giving them care. There is a number, I don't know if it's 20%, there are a number who prefer a female for sure. And surprisingly, there's about 5% of women who want a male doctor. And I was surprised. I actually had a patient who only wanted a male physician. That was her stereotype, that she preferred to just have a man. Some people think of the doctor as a graying white male, and she says, but don't worry about it, I'll be okay. And I said, well, if your preference is a graying white male, what do you consider me? Mm-hmm. And she says, you're honorary graying male, white male. Well, it's not realistic to think that way.
Was this an older lady?
Yes.
Because I have experienced this as well in talking to patients about this issue, even though I'm not an OB. And I've found a few individuals who prefer a male doctor, and they I thought it was a generational phenomenon to some extent. But that's interesting. I think it's wonderful that you try to have these discussions in a sensitive manner. And again, I found your book to be extremely humorous. You even talked a bit about your wife. I think you said that there was a bit of a culture clash when you met because she was from a family that was half Anglo and half Saxon, I think you joked, and that their family liked to eat either meat and potatoes on one day or potatoes and meat. And that
yes.
Having a Japanese-American son-in-law was a surprise to them, and you managed to bridge that cultural divide too.
I hope she doesn't watch this video, but yes, so her family's from Flint, Michigan.
Yes.
And in 1977, I don't know if it's still that way, but I never saw an Asian person in Flint, Michigan. I went to the mall, I went out to restaurants, and I'm sure there must be some there, maybe more now, but then I did not see any. And her mother told me that we're not prejudiced. On the other hand, we don't have any colored friends. They wanted me to feel at home, so they took me to a Chinese restaurant, close enough, since I'm Japanese. And after dinner, pleasant dinner, the parents went back to her apartment. I thought I would sit down on the first floor, even though the apartment's on the second, and see if I could eavesdrop on their conversation. But realistically, you cannot because, the door's closed, they're on a different floor. But there was so much yelling for so long that I got the information that I was seeking, which is they were not going to accept this marriage, or at least there would be a lot of arguing about it. And I would have thought, I'm physically pretty normal, had a good job as a physician, but to some people, race trumps everything else. It didn't matter if I was a good physician or intelligent.
Yes, I think also, Dr. Matsumura, it may vary by particular families. If I may share this with you, my wife is of Filipino extraction. I would say, by the way, that you're 100% American, but you're of Japanese ancestry, rather than 100% Japanese. But in a similar way, my wife is American, but her family is from the Philippines, and she has a cultural connection there. Her parents came to practice medicine in West Virginia, and there were no Asian people there at all. To make a long story short, it took them a while to get used to them. They ran a newspaper saying, these are the Castros, but not the one from Cuba. But then they welcomed them with open arms, and she still is welcome to go back, and they did not have a negative experience in West Virginia in the 1960s. So perhaps it varies from family to family. But, our time is running a bit short, and I'd like to kind of shift gears, if I may. And you have a chapter in the book where you talk a little bit about what it's like in medicine and the future of medicine. And the chapter is titled, Don't Let Your Babies Grow Up to Be Doctors. And by the way, I'm kind of a country music fan. Is that Merle Haggard?
I don't know, but there is a song like that.
I'm wondering if it's Willie Nelson or Merle Haggard, but I know the song.
It's "Don't Let Your Children Grow Up to Be Cowboys"?
Yeah. I mean, I should have explained that, but it's obviously adopted from that. Very, very witty. But what do you see for the future of OBGYN and medicine in general, and what wisdom can you impart to our audience that might help them as consumers of medical services and patients and colleagues in the medical field? Where do you see medicine going, not just technologically and in terms of research, but in terms of the doctor-patient relationship and so forth? Do you have a feeling for where we're heading, and are you optimistic? By the title of the chapter, I take it that you're a little bit hesitant to even recommend the field of medicine to young people.
Well, I understand that your two children are going to be physicians, which I think is very admirable. But I, like maybe 60% of doctors in practice, would advise their children or friends not to go into medicine. I think a lot of us have suffered burnout. I have myself. And the way that burnout manifests itself, I think, is in cynicism, where people will say things and act certain ways that if they had had a good night's sleep, maybe they wouldn't have spoken the way that they did. So I think I would have chosen something else. Certainly I didn't have to go into OB, which has a lot of work after hours. I could have chosen some other specialty that, you go home and maybe you don't take call, maybe you don't have hospital privileges. But the biggest change I've seen recently is the electronic health record, which we really need to have. I can certainly remember the days when we would write in charts, and the patients didn't have access to that. One, that you couldn't get the record easily unless you subpoenaed the records or asked for them. Second of all, if you got the records, you couldn't read them. I know several physicians who have admitted to me they couldn't read their own handwriting consistently. So we're never going back to those days. It's nice to have the electronic record. Patients have access to the visit, so now we doctors have to be careful what we put in the chart. You don't want to necessarily say this patient is drug seeking or so on, because she has access to that. She has access to her mammograms and she has questions about it. She has access to her labs. And you start emailing back and forth. She asks a question, you answer it, now she has 3 more questions. I found that I would go home and have several hours of work to do. Mm-hmm. And I believe that will be solved with AI, with Salesforce using something they call Agentforce, not trying to push their stock or anything. I'm sure other companies have it, where eventually, instead of getting on the phone and going through this queue where you push 1 because you want to change your reservation on United, press 2 for something else. Eventually, I start yelling, "Representative, I want to speak to a representative," right, which you usually don't get. But I think in the future, we're going to say, I want to talk to the robot, because they will know your whole record. They know all your labs, everything, and the person you're talking to doesn't. And I think they'll be able to answer your questions better than a human, and that may solve the problem. Patients have told me that nowadays doctors sit at their desk typing and they're looking at the monitor and not at them.
In fact, I'm also a consumer of healthcare. I go to see doctors, and I've had visits with doctors where I've experienced that. And I've sometimes thought, gee, you'd think because they know I'm a doctor, they would kind of do a more thorough physical. And some doctors have. I recently saw a doctor who did a very meticulous physical. But others get so engrossed with the laptop that they hardly notice you're there, let alone really checking you out. And I don't say that to criticize anyone, but to say that the technology draws us in to the exclusion of the patient. And I also think that the doctor-patient relationship now involves other people in the room, even if you can't see them, third-party payers and so forth. And that undermines the relationship. And then with the advent of the information age, often patients come to appointments with a kind of consumer perspective, and they've read things online, and they may want to sort of debate various treatments. So I think we're going to sort this out. The younger generation of doctors seem very sensitive to these issues. I see a lot of doctors who I feel very positive about who are in training. But I'm kind of with you. I'm of your generation, and it's a different world. Well, do you have any advice to members of the community as to what they can do to maximize and improve their relationship with their doctors and their health care in the field of obstetrics and gynecology, but also in medicine in general as we begin to wind down? And also, where can people get your book?
Well, I would hope that patients would try to not have an adversarial relationship with their physician. You're both on the same side. I have had patients that looked up their symptoms on Google and are trying to tell me what they have. And I imagine that's why pharmaceutical companies do direct marketing to the patient. They will come in and tell you which drug they want and why they need it, and that actually is not allowed in other countries. So I hope they try to have a good relationship with their physician. Doing these video visits, in some ways, it certainly has hurt the physical exam. On the other hand, my doctors are at UC San Francisco. That's my whole day gone if I have to go into San Francisco to see them. So I really appreciate being able to see my doctor by video. So I'm optimistic that things will continue in the right direction. As far as my book, it's available, of course, on Amazon. You can go to my website, GaryMatsumura.com, and you can see where it's available. There's a dozen places it's available. You can get it at Barnes & Noble in Fairfield, but again, they put it under the pregnancy section. I prefer it to be under the humor. You can get it online at barnesandnoble.com. It's in print, as you can see. It's you can get it electronically for your tablet. A friend of mine has asked if I would do a Audible version, and so far I don't think I'll be doing that.
Do you have any other writing projects in the pipeline? I know that you also play ukulele and do other things and are an athlete and go work out and so forth, but do you have time to write anything else?
I have about 20 more chapters written for another book. I don't know that I'll ever write another book. This one took 20 years, but I'm retired now, so maybe I could.
Well, Dr. Gary Matsumura, it's been such an honor to have you on Health Focus, and I also wish to thank you for your decades of service to the community and for enlightening us with the information in this book, Adventures in Obstetrics, which I think is a fine book and a fascinating read. So hopefully we can continue this conversation.
Thank you for having me.
It's been a pleasure. Remember, here at Health Focus, we focus on your health. Today we focused on a lifetime in obstetrics, and I hope that it was informative to all members of the community who are interested in learning more about medicine and optimizing their relationship with their healthcare provider. And I look forward to continuing this conversation in the future. In the meantime, have a great 2025 and stay healthy out there.